Well, thank you so much, Sandy. We are so privileged at the Center of Sierra Health Foundation to be doing this work with you and all of your partners at Epic Media Services. So thank you so much for presenting us with this opportunity. And I want to say thank you to all of our media partners who are joining us today. At the Center of Sierra Health Foundation, and we are a statewide nonprofit organization, we truly believe that every person deserves an opportunity to live a healthy life of their own design. And we're achieving this vision by focusing on access to care, quality of treatment, and youth prevention in our portfolio of substance use programs. We manage a number of portfolio, but for today, the focus is on our substance use programs. According to the Center for Disease Control and Prevention, otherwise known as CDC, in 2022, more than 109,000 Californians lost their lives due to overdose. Locally, that equates to the amount of people who can fit up to the local Sacramento Kings Arena, 6 times over. Overdose is the leading cause of death for non-elderly people in California. Let me say that again. Overdose is the leading cause of death for non-elderly people in California. And sadly, these numbers are only expected to increase. Let's talk a little bit about the challenge and how we got here. Historically, the federal and state government have responded to drug use with incarceration and extreme policing of Black communities. Under the banner of a war on drugs in the 80s and 90s, the federal government criminalized drug use and drug possession through a series of punitive laws. For over 50 years, we have all suffered the consequences of mass incarceration. People of color and those from low-income communities were disproportionately harmed. And people who use drugs have been deeply stigmatized and underserved through it all. However, we know that people who use drugs are deserving. They're not strangers, right? They are our neighbors, they're our family members, and our beloved friends. Fortunately, the good news is that the tide is turning. Community advocates, and you'll hear from 3 of them today, and families have led the way in showing the government that we can prioritize care over criminalization. At the Center of Sierra Health Foundation, we believe in centering the voices, humanity, and needs of people who use drugs in related policies. Our programs are aligned with this vision. So what is our approach? Throughout our decade of service, and yes, Sandy, we are so thrilled to be serving our 10 plus years of existence, the center have had the privilege of managing approximately $677 million in grants for the continuum of care around drug use. On behalf of the state of California and in deep partnership with the state, we manage programs that work to end opioid overdose death. Some of our partners focus on sharing useful and honest drug education with young people, and others are supporting wellness for people who use drugs. The center's focus on normalizing harm reduction approaches through public health and healthcare setting, including access to safer drug use tools and holistic, non-judgmental care, regardless of a person's drug use status. And we do this by partnering with community-based organizations that are disproportionately underserved and harmed. We truly believe that people who are closest to the harm are in the best position to determine what the solution is and be able to bring to it transformative, creative approaches to addressing the issue. And that is why we've been intentional in our practice, in the way that we work with partners, in supporting efforts to open many doors to care so that people can walk through the ones that best aligns with their vision that they have for themselves. If you or someone else in your family are using drugs and would like to make a different choice, there is help. I want to make sure that our community partners know that, and you don't have to go at this alone. So today, as Sandy said, you'll have an opportunity to hear from 3 of our many community partners who are doing incredible work in their local community, who are each responding to the community's needs in their respective ways. In Marie, in Bronze, and Arlene, you'll hear about their approach and how they're working deeply and unapologetically in BIPOC communities, and how they bring to it a culturally and linguistically appropriate lens to the work that they do. So with that, Sandy, I want to thank you, and I'll turn it over back to you.
Thank you. A couple of questions. You said
ko e lea ko ia tō taha ko ia ni tau tok whanongo ki ai, ko ta whewhine ko ni ko King Hang, pe a ko Palestinian o senta ko ia ko Sierra Health Foundation. Ko taha ne senta ko ta oene hongo fulu ene whai whatongia i estate ko ia o California. Pe a ulahi au pito e nao ngai te whito i ngā aue o whai, pe a ko taha o ngai kawenga ngā aue ko ia, ko hona toka ngai kina o e whai to o kona tapu, pe ko e kakai ko ia o kunao mo utamakia i e whai to o kona tapu. I e taimta tau ne whamatala foki ai kaunanga ko e ni, ka ko e Palestinian o e sentani, nane whamatala o pehe, ko e taha o e ngāhi mea mahu inga o e senta ko e ni, ko e nau wakai ki ngai statistika o ki nau tolu, o ki nau mate pea me he overdose, pea me he whaito o kona tapu. Aia o ku kau foki, ai lipoti ko e ni pea me CDC, pea ko Centers for Disease and Convention, katake. Oku kaufu ke na wakai ki ngai statistika ko ia o mai e CDC, aia oku na upehe, i he wafe mawo wa ne au ai kakai ne mate overdose i Californiani pe. Pea me i he whaitoko na tapu, ne au ke toko takilu hi wafe. California ata tape ne au ke toko takilu hi wafe, ai kakai ne nau mate, pea me he overdose, pea me whaitoko na tapu. Na ne pehe ko toko lahi taha e kakai ko ia, ko e kau colored people, pe ko ki tau tange ko tau tolu, pe ko e kau mua kau uri uri. Na ne to e whamatala pe foki o pehe, ko e toko lahi taha e kakai o kunau mate, makatu unga pe mei he overdose, ta whatatau ke tau, o me mei ke tamaiki, pe ko e adult. Aia tau whafufua, tau whango futupu, pe to e si iange. Aia ko tau whango fulu pe to e si iange, ko e toko lahi taha kakai o nau mate California, o ku nau mate ki nau tolu ia, pea mei he overdose ko ia i he whaito o kona tapu. Nane to e whamatala pe whoki ngai tau e ni mango fulu ko o si, na e whakalahi pe e he pure anga ai ngai tau tea ko ia ki hono mau, ki nau hataha o mau pa me whaito o kona tapu, pe o mo utamaki e whaito o kona tapu, pe au alpeta e mimo to ma mafanga ngai tau tea. I he taim te tau. O alpeta e mimo to toko lahiang e kakai o nau ngawe pōpula, makatu unga pe me he nau mo tamakia, pe me he whaito o kona tapu, pe ko e nau whakatau atu ai whaito o kona tapu, pe ne mau ki nau tolu pe mo whaito o kona tapu. I he taim te tau o kune pe foki, ko mau e foundation ko e ni, ha paanga o ke paanga o no ngau fitu miliona ai tokoni ai pure anga pe ko federal government kai o mai tokoni ai state ke na whai nga we ko ni ono tokanga ki na ko ia o e kakai o mo tamakia e whai to kona tapu. Na ne to e whaha whoko paanga ko ni na e wahea i ngai ngawe keke o kawa ngai ngawe ki he kakai ko ia o nau overdose o kata o nau ngawe ake whai to kona tapu ia e ngai ngawe na whahoko ki e whanau to tupu ko uhi ke nau whaka ehi me whai to kona tapu kai o maafoki ai ngahi polo kalama ke kepe ki hono toko nii ai kakai o nau lolotonga ngawe aki ai whai to kona tapu. O kune peheu nau whengawe aki pea mo e ngahi kau taha i kai whakapure anga lahi au pito pea ko pea ko e ngai kau taha i kai whakapure anga e tolu na e to o mai ke whai na e talanoa ki e nau wa usia whekau aki mo e nau ngahi ngā ue koia ki he whai to o kona tapu. Aia ko ngai non-profit e tolu ko e ni te tau wakai ki ngai lea koia i he time si pe me hen ka ko tu ho me ka inga ko taha ne me mahu inga ta ka ko fu ka taha ko ni pe ko non profit organization ko ni o gune toko ni i ko ia i nga issue ke la ya pita ngai programa le tio na fa pa anga ta te fito ke ngai programa ko ke COVID-19 ko ngai programa ki mu atu ka ka we ni i na programa ngawe ka te ta ho ko atu ki he to taha ko ni Ko e tō taha koe ni, e whai e ne lea koe ni, ko tale e kita Executive Director ia o Central Valley Empowerment Alliance. E tala noa e tō taha koe ni, ke nau ngai whounga o nau whakahoko ki hono toko ni i koe ia o e kakai o nau ki community. A nau ki community, koe uhi, koe whai to o kona tapu, pia nau whengau e aki wawhi au pito pia moe to utupu, aia koe taha peni ai whounga koe ia o nau whengau e aki ai, pia moe kakai ho nau ki i kolo. Koe ki i kolo koe ni te talanoa ki ai, koe taha ia e ngai kolo ngō ue pe koe ngai farm community i Californiani. Ka koe hingoa whiwhine koe ni, ko Marie Perez Ruiz, aia ko Executive Director ia o Central Valley Empowerment Alliances.
For creating a space for us to share, the lived experience of our rural communities. I would love to start with just showing this beautiful photo aerial photo captured by Adam Perez of Poplar. And this is just one of the many communities that we're working. It's a population about, the census indicates 3,200, but we know that it's over 5,000 people in living within 700 dwellings that are decaying. This is one of the, located in Poplar. This community is very rich in so many ways. The UFW farm worker movement began in this community. The fields that you see around are the ones that were negotiated by Dolores Huerta and Larry Iliong and Cesar Chavez in the 1965 grape strike boycott. And this is where the first agricultural labor contract was won. And currently Tulare County does not have a union contract. And the fight to empower farm working communities in the 1965 led to a number of redlining policies that have impacted us today. The Tulare County housing element has indicated that Poplar is one of 13 out of the 15 communities in Tulare County that has no future. And because it's been defined by the housing element as a community with no future, that meant that there hasn't been any investment, any infrastructure in rural communities. In 13 out of the 15 rural communities in Poplar. And so, with the opportunity that we've been gifted by the center, we've been able to negate that narrative, and we continue to fight that narrative that communities like this don't have a future. The dwellings are decaying, there hasn't been housing developed in over 50 years. And you see 3 generations, of over 20 people living in small 2-bedroom dwellings. And this has been impactful in so many different levels as we address health access and health equity in our communities. So I just wanted to start with this visual because this is one of the many rural communities that we're working. This particular community has 40% Filipino farm workers, new immigrants coming from the motherland, speaking Ilocano, and the other are about 50% Mexicano, Spanish speaking, and then we do have Yemeni because our Najib Daifala, the martyr that was killed in 1972, he was organizing the fields around that you see here. So there is so rich in history, yet it has been neglected and there hasn't been any infrastructure. It doesn't have a park. It doesn't have a clinic. There's no fire, no first aid responders or all of those systems were closed once, the 1965 grape strike, the first labor contract was signed in the 70s. And as a result, communities like this were punished for that. And so if we can go to the next page, slides, we serve 5 different counties, Madera, Tulare, Kern, Fresno, and Kings. And our focus is primarily on incorporating farm working communities. Just because we have found that, in our rural communities, there seems to be so many different, this is where the most vulnerable of our community members are at. This is where in Madera, we have a high concentration of indigenous from Mexico farm working community. In Tulare, we have our Filipino and Mexicano farm workers and Hmong. In Kern County, we see our indigenous and immigrant Mexicano farm workers, and so forth. We see that quite a bit, but yet we noticed, that there hasn't been an effort to really go to the rural communities, because quite often, some of our big organizations tend to go where there's a higher population. It makes sense for many of them. You go in, you get the most people and so forth, but we are different. We are intentional of going to the most rural, unincorporated, where you see 300 homes, 100 people, 5,000, whatever it is. So we actually kicked off a campaign, our rural health equity campaign, led by our youth. And we actually have gone to Tonyville that experienced the floods. I don't know if you saw it in the videos. It was in the media. And this is an incident where the floods happened. Our rural community was flooded. Yet, we have the FEMA bring the Homeland Security and table together. And so our community did not show up because of the fear, and so forth. Can we go to the next slide? Thank you. This is, our youth. This is some of our youth captured in one of our enrichment programs, activities that we did. We brought them to the Oakland Zoo. And then we decided to make it, swim by. They wanted to walk the Golden Gate. This is the first time for most of them that have ever been anywhere near the Bay Area, or seen the Golden Gate, or seen the ocean. There's nothing much is expected of them. Only 3% of them are expected to pursue a higher education. It does not mean graduating. It just means, they attend, and many, there's very, very little data, but all of them are receiving the free lunches. You see a diversity of here. We have indigenous, we have, Filipino and Mexicano. And that is what we're trying to aim to do, is to build a beloved community. I see promise. When others said there's no future, I see a beautiful promise of what it is possible. And our goal is, our values are aligned with unconditional love. We're not afraid to say that, unconditional love. And organizing is an expression of.
Ko e tahawhakeni o ngahi presentation na whahoko ko ia I he whatahani a ia ko taha ko ni ko tale kita ia Central Valley Empowerment Alliance. O ku ne talanoa ke maho inga ko ia ai whenga we aki pea mo e to utupu. Ka ko e kautaha ko ni o ku tu uia I Tulare. Pe hange ko whamatala ko e na ne whahoko ki mu a. O nau tokanga I kina a ngai community e Nima. Aia ko Madera, Tulare, Kern, Fresno, pe mo Kings. Ko e ngahi community e Nima ko toa ko e ni. O ku iai pe ngai whaingataa o nau whekuki moia. Hange ko e ngai whaingataa whakai nofo anga. O ku ne pehe, o ku iai ngai apia ni ihi koa o ke toko ua noa. O ku nau nofo ia ki apartmeni loki ua. Ko e ngai whaingataa ia ko whaingataa whakai a whale. Pe ko nofo anga, o ku kau ia whaingataa ia nofo ko e ni, ia wheitu uni. Pea ko e ngai community e Nima ko ni, ko Madera, me toko lahi taha kau Mexico. Ko Tulare, toko lahi taha kau Filipino, pe ko e toko lahi taha kau Filipino. Ko Kern, ko toko lahi taha kau Native American, pe ko indigenous people. Aia ko ngai community ko ni me toko lahi ia ngai kai ko ia kala. Ko ngai ko community e ni o wheitu ko ia whai anga ngowe ko pe lahi taha ngai whai anga ngowe I California. Na e to tafo ke e nau o mai e to utupu ki he Golden Gate Bridge. Pea o pehe ko toko lahi taha to utupu ko ni. Mana tui ko Fresno ben mahalo ko waiua lele ko me heni pea me San Francisco ki Fresno. Ka tarang he to utupu toko lahi taha to utupu ko ni most of them. Teke ke nau sio na to he Golden Gate Bridge. Pea ko ngai community ko ni o ku talanoa ki ai ko e lahi au pito ai whai to o kona tapu. Lahi au pito ai whai to o kona tapu. Pea pane tau wakai ke ngai uni o ngongo ki mua te ngai mahina ko maliwatu. Na ia mea nai hoko I he taha ngai community ko e ni. Ko e hua tu pe toko taha ia whana ko toa. Ko tui maha ko e ngo mātua. ko ena taahine mo ena ki i pepe ana e mate kotoa ia i he whale pe e taha. Ai au ne pehe toko lahe o pito kakai ko uhi ko tu unga whakamasive siva koe o kuia e ngai kolo koe ni o toko lahe o pito kakai o nau ngai aki e tila koe ia oi whaito o kona tapu. Pe i e taim ta tau pe o aluhake pe a moe whanau o nau ngau e ake whaito o kona tapu. I e tau tupu whakakatoa koe pe koe ngai high school o community pe koe kolo koe ni ko Turare. Pe seti pe tolu ia ki nau tolu e lava ke nau wo ki higher education. Pe koe ngahi kolisi. Koe pe seti koe toenga koe o i tau tupu o kune pehe e ia whainga taa au pito ke nau wo ki nau tolu ia ki ngahi apiako koe utoe maa o lungange ko hono uhinga koe lahi koe ai masive siva pe aluai koe hui koe ke o koe ki ako o aluai ke toi toko lahi angea i whanau tau tupu o nau whaihia i he ngai kolo koe ni pe toi toko lahi ange foki pe moe whanau tau tupu o nau ngau ake whai toko na tapu pe kai ngatai ka aku toi toko lahi pe moe kakai o nau mate koe uhi koe overdose. Ko taimiko o ato e ngai toko ni koe pure anga ke te nau tau na toko hoko tā whea i ho nau wheitu u i e ngahi tau koe ko mari watu pe na e hao e whima pe moe ngai toko ni e pure anga o na woke ki community koe ni ka ne kai ke nau whie o mai na toke whakataha. Koe hahana uhinga he oku toko lahia ki nau tolu o nau ngāwe pe nau nofo ta e whakalao i whanuani. Pe nau mawai pe e nau tolu a e tairi iri koe ni. I taimte tau, koe community koe ni, pe koe kolo koe ni, o koe kia hapaka i ai, o koe kai ke aha kiriniki ai, koe first respond, o koe kai ke ia ia, aia o mole au pito o te kei ke mau e ki nau tolu ai whakalakalaka o te tonu ke nau mau. Mga tu unga he ngai mea whakahistoria, pe koe mea historia na e hoko ia i he ngai tau ko maliwa tu. Koe ngāwe lewa ai kautaha koe niu nau whengawe aki pia mo tau tupu. Aia koe tau tupu o nau whengawe aki mo ia ke nau malawa he tau tupu o mao ha iwi wheunga mo ha ilo wheunga ke nau o atu ke toenga o e kolo o whai ai ako mo ngai polokalama whekau aki pia mo e whai toko na tapu. O nau whahau ke nau polokalama tu o taha i he wike ko toa pe manatu ko ngai non-profit e nau toko ni ia pia me i he federal government whakafou mai i he Sierra Health Foundation. Whahoko lewa e nau ngahi polokalama ai tau tupu, pe i he taim te tau pe o nau wheinga i ke whakotuu pe mo whauha ngahi polokalama, e lava ke whakahoko kia ki nau tolu o mo tāmakia koia i he whaitoko na tapu ke o ngo i e he kakai koia o kui kai ke nau, o kui kai ke whakamake ke he i ki nau tolu. Aia koe whatongia lewa ia e nau ngahi kautaha, e nau kautaha, ko e nau wheinga, ke whasisi hono lumai o ki nau tolu koe o whaito o kona tapu. He koe lahianga hono lumai ki nau tolu, koe lahianga e nau mawahia ki nau tolu ia pe me community o whakahoko ai ngai hia keke o i kai ngatai o alwai pe o nau sia o kota o na kita. Koe mahu inga tahaya e polokalama, ai konga e polokalama koe au nau whakahoko, ai nau pehe oku mahu inga au pito, ke tokanga i kina koia ki nau tolu mo tāmakia whai toko na kona tapu, ke ua te nau o ngoi a hono luma i ki nau tolu. O tui ko tau tolu koe ni ka inga tonga, o tau osi, ko tau osi lawe i ko toa pe ai tukunga kui ai. Kai aha toki whamiri pe ko hato maheni o ku mo tāmakia whai toko na tapu, ko hono luma i ona o kalaske. E lawa peke pe te ko ki tila e na ulue mai ko na ko ki IC e na ulue mai ko na ko na he polokalama ko ni fai ka tala no hange ko polokalama ko mo to tupu e taha ngai community ko ni o na faka amu pe ko tau mu ai polokalama ke fai ha whenga aki ki hono pop hono toko ni hono support o hataha o mo tāmakia i fai toko na tapu. O kai ke ngā aue e whaunga ia ko hono whakamake ke he i ki nau tolu. Pe ko hono luma i ki nau tolu. That doesn't work. Koe o nau pehe, koe solution ia koe o ku ngā aue he taimini, ko hono whakakau ki nau tolu i ngai mea ko toa pe, koe whakawhanongo ki nau ngahi fie mau, pe pe kai ngatai ko wakai ke toko ni ianga na mo ui pe awa ke na wongo I ko ke ki na to pe discriminate ki na to o pe he polo kalama ko ni ko ngahi polo kala ko ngahi te fino ngā awe ia o ngā whakahoko e taimini. Pe hange pe ko lea koe tō taha koe pe ko Palestini koe ia o Center at Sierra Health Foundation ane nai, nane pe he. Ko kakai koe nuk mō tāma kia I whai tō kona tapu, ko tau toko ua pe, ko tau tonga ane pe, ko tau kau ngā api pe, ko tau whaamiri, ko tau maheni. O fie mauia ke tau ko tau ngahi ulunganga ko fai ke nau tolu ke nau wongo I inclusive ke nau wongo I nau kau pe e community ka ewa mo te tau fai ha mea ke nau si I ongo I pe te luma I ke nau tolu ke ongo I ai hange ko nau toi maulalo ange ki nau tolu I he community aia ko taha ia ai ngai ngawe mahu inga o non-profit organization koe nau ngawe na tō mo tō tupu ne ongo koe whetung nau no whai o kau ia ngai whetung masiva taha I California ni ka I he taim ta tau pe o nau wheinga ke nau hanga o toko ni ngai palpalema o au ke palpalema une pe koe aluia koe ia ai tokolahi koe ia kakai koe o nau overdose pe me he whaitoko na tapu e aluia ke toe tokolahi ange o te kei ke whakasi o ia e lava ke holo. Ko ngai whaunga ko tōna e whakahoko e ngai tau ko ia ni mango fulu kua o si. O kui kai ngā ua ia he ku alu ia ke toe toko lahi ange kakai au nau mate overdose ko ia pea mei he pea mei whai tōko na tapu. Ko ha e ta me atau ai whai. Ko ngai example pe nuk o mai pe mei ngai lea ko e ni ko ngā ke tau wakai ki ai lava pe ke tau wakai ke tau community tonga mahalo pe lava fotu e whangaki non-profit organization pe he. Te tau hoko atu ki e lea hono hoko, ko lea hono hoko ko Arlene Brown, ko CEO ia o Crossroads Recovery Center o e pea Muscodan Native Harm Reduction Services. Ka pau te mo whanongo ki lea ko ni ko tahane lea ko mahu inga ia au pito ai koe uhi ko ne lawe ke mahu inga ko ia honau urunganga whakafonua. A traditional ways ko ia ai kau Native American. Ka ko whiwhine ko ni ko CEO ia o Crossroads Recovery Center pea Muscodan Native Harm Reduction ko Arlene Brown. Ka tuke tau wakai ki he lea ko e ni.
Enrolled member of the Bishop Paiute tribe here in where I live and work on the live on the reservation. And I'm humbled to be here and honored to be in this space with everyone and to give some insight into it, the crisis here and everywhere actually for Native Americans. As you guys may or may not know, Native Americans have some of the highest fatal overdose rates, not just in California, but nationwide. And so it's a very, huge issue. And, we are the original people of the war on drugs, right? We were the first victims of that actual war on drugs. And so that has been something that has been with us ever since, colonization started way back when, right? And so one of the things, that we really specialize in is decolonizing services because there are services that were never built for us in the first place, right?
Say that again, Arlene. Decolonizing services and what is meant by that. Many of us are not English speakers primarily, so it would be very helpful to have you define that term.
So we have services that have been built for us by service providers in that colonization process. And so decolonizing it means that we make it our own. And so that we take down everything and dismantle it. And so we make it our own. We want to make everything indigenous, right? And to make sense for our own culture. So that's what I mean by decolonizing services.
Great. Please don't let me interrupt you. You're on a roll. Go.
So like I was saying, being the very first victims of this war on drugs, we're able to fight back in a way, with the center's help in some of the grant funding that we've been able to receive to do amazing programs like naloxone saturation, and but we just do it in our own way. So we have opioid overdose reversal kits, and we have them completely indigenized, all the way from like prayer tags on the bags, culture kits that we're able to give to people. We know that first responders are people who are using drugs, and so one of our programs that we've created is the Wellness Journey, because we also know that isolation and stigmatizing and further pushing out people doesn't work, right? We know the punitive piece doesn't work. And so we want to make sure that we are engaging and working closely with people who are using drugs. We also operate one of the first certified syringe exchange programs in California for like that has been culturally
Just
specific.
say it again, because you're speaking a little fast for our interpreters. Say that journey again.
It's the Wellness Journey, and it's an indigenous-based model of care that I created to engage and work actively with our Native population who are using drugs. And so it engages them weekly with case management services. It has them, we do a program, and it's based on contingency management. But see, we made contingency management our own because we decolonized it, right? And so we have it in a medicine wheel, and so participants, they just make their own goals, and they could be health related. They could revolve around their physical health, getting tested for HCV or HIV, whatever goals that they have. Spiritually, mentally, physically, and emotionally, because one of the things, like with the Western model of care, is just treating one symptom or one piece or one part of a person. And we know as Native people, you treat the whole person. You treat the individual, the family, and the community, right? And we've never needed anyone to tell us what our healing ceremonies or practices are, which is why substance use services like traditional ones weren't designed or created for us, because our healing doesn't take place within those four walls of what like people will say our healing should look like, right? And so we just take ownership of that process. And so the healing journey could actually get people right from using substances to rehab if they want to go to rehab. But the engagement piece is huge, because the other part is the connection with culture. We have language cards that are done in our Numu language. We give out traditional medicines. And so we found a way to try to keep people inside of our sacred circle. And so we talk and speak, in a lot of cultural terms. So it's important to us to keep our loved ones who are out there using drugs and alcohol, to keep them within our circle, because we don't want to further isolate, shame them, and punish them for substance use issues, right? We already know that doesn't work. And so the Wellness Journey helps us do that. It gives us a way to protect our culture. It helps us reduce the overdose in our community. I know we've had over 80 people's lives saved. And then we share our healing with others, right? So our programs are never just for Natives, even though they're indigenous, and they have that whole framework. One of our core values as Native people is our generosity. And so we share in that healing with others. And so everyone is welcome in that space.
Could I ask you quickly to tell us, Inyo County has 5 reservations, and some 17% of the population, you told us, is Native American, predominantly living on these reservations. Is there a stigma in tribal communities about people who do use drugs? And is one of the ways you're combating this to show the embrace of the Native community values and rituals that are not closed off, that indeed they are part of the healing journey?
Right. So we've done a lot to destigmatize services, and early in this session, there was
Ko tui be ho e mo ka inga mahino pe maho inga mali a lea ai fefine ko ni ko to taha ko ni Ko e CEO ia o Crossroads Recovery Center and Coordinated Harm Reduction Services. Sa ko hinga ko ene lea ko hinga ngā ue whapatonu ia I he o nofo pe ko e Native American o nofo pe ia I he nau reservation pe a mo nau community pe ko ngā ue ko ni o whai ki he community ko ia o reservation ko ia. Sai, ko mea ko mahu inga ia taha I he lea ai whiwhine koe ni, koe nau mahu inga ia I ho nau urunganga whakafonua. O nau mahu inga ia pito nau urunganga whakafonua. Neongo koe kau India kula, maha koe tau ia koe a kau Native Americans, ko ki nau tolo ku le kooti I he toko lahi taha ai kakai whakawhianaki ki he matakari, ai kakai o ku mate me overdose. I kai ngata pi Californiani kai Amerikani kotoa. O ko mai e lea koe ni a ene statistika koe ni, ko nautol ko Native American o ku toko lahi tahai whakawhianaki ki he ngahi matakari ke he, ai kakai o ku mate koe uhi koe overdose pea me he whaitoko na tapu. I he taim te tau pe, ko ki nautolu ai victim toko lahi taha whakawhianaki ngai matakari ke he, I he war crimes pe kono tau I koe neu whaito o kona tapu. O ku iae ngai whaunga ke he ia o ku nau whakahoko, pe o ku ne pehe o ku nau hanga e nau tolu ia o decolonization ai ngai service, pe o ku decolonize ai service, pe a whehu I focus Sandy, ke ne te o mai angeha te ki whamatala whekau aki mohono decolonization, pe ko decolonize ko ia o ngai service, pe ne pehe. Ko ngai service ko ia na o mai pe na introduce ki ho nau matakari, pe ko ngai service ko ia na introduce ki ho nau matakari, kata kia. Ko fa mo modern. Ko ngai service ko ia ne ave ki ho nau reservation. O ku nau hanga e nau tolo riu. Ko uhi ke whakawhetau laki pe a moe ke whakawhetau laki pe a moe e nau urungaanga pe koe nau ngai tō o ngā whawhonua. O ku maho inga au pito kia ki nau tolu. Aho nau ulunganga whakawhonua. Te tau whakai whao. Ki he rea koe ni ka tau tō hoko atu.
The name HIV Education and Prevention Project of Alameda County is long. So if you hear us refer to us, it is HEPPAC. We have a program that's supported by Sierra Health Foundation that I created called East Bay MAT Expansion. And so this is EBME. You know, in public health, we talk in a lot of acronyms, so we can cut to the chase. And part of EBME's main goal is to get out of silos and create equitable access for medication assistance treatment, which we call MAT, another acronym. So HEPPAC has been in harm reduction for 30 years and is an internationally known, nationally recognized, and locally respected Black-owned and Black-led harm reduction agency in the Bay Area. as you stated, our brick and mortar, the building that we are so fortunate to own, is in Central East Oakland. And we serve a lot of places within Oakland from west to east, but we also serve our neighboring county, Contra Costa, and the neighboring county to Contra Costa, which is Solano. So HEPAC's approach is on a regional basis, which is what we are working towards in the East Bay MAT expansion, getting people out of their silos. Our goal of EBME is to just that, getting all the providers that are offering MAT in the different ways that they offer it, and we get together and we talk about best practices. We talk about equitable access. And to start with MAT, we start with the conversation around harm reduction and recovery. Recovery from an older perspective, a lot of folks think means sobriety. So our goal is to talk with people openly in an ambivalent way around their relationship with their drug use. Not everybody who is in recovery is going to get to sobriety. Our goal is to meet each individual where they are at geographically, as well as within their addiction, about where their goals are and where they're trying to get to. What are the great things about their drug of choice that they decide to use? And what are the things that they want to change that are unhealthy? Because some people will never get to a point of sobriety. But if they're doing something to administer their drug of choice in a healthier way, that is their recovery goal. Harm reduction, as we talk about it, is a spectrum. So we've got people in their chaotic stage of use who everything and anything that they're doing is about administering that drug, right? Their lifestyle. Then we have other folks who are on the other opposite spectrum, which have decided maybe abstinence is the best way for them to work on their use and work on their relationship with their drug. And we meet people in between all of that. Our goal and how we do this is by hiring people with lived and living experience to be substance use navigators. So this is what we kind of have as a norm for us. We take people who have either been in substance use recovery, currently in substance use recovery, active users, right, who are interested in working with their peers around accessing MAT in a different form. It's not always in a clinical setting. So HEPAC hires substance use navigators who may have been people and participants of our syringe service programs in non-clinical settings, in these areas you see in my avatar backdrop, where we're out in the community in what we like to call the trenches, in areas where there's not a lot of services. We have to think about access in the way as some people think when we go to a doctor such as Kaiser, that that's our only access to medical. When we look at access as universal, when you come to a place like HEPAC who does non-clinical settings, integrated services, where we have a doctor, syringe access, substance use navigators, hygiene kits, coffee, snacks, things of that sort, that people are actually accessing medical. We traditionally don't go to the Kaisers and the medical homes to get food and safer drug using supplies and have an open dialogue around the ambivalence of their drug use. Because most of the time when folks have been in their experience, it's been very punitive to talk about their drug use. And they're just referred to stop using drugs. When they can have open dialogue around how is your drug use doing? What are you doing within your drug use to stay safe, to prevent from opioid overdose, to prevent from abscesses, to prevent from death, right? How do we not only survive while we're still in this war on drugs, but how are we thriving? Substance use doesn't live in a bubble. And because we have integrated services, we're always addressing the term that everyone is using, and you'll hear it a lot, social determinants of health. We know that when a person is wanting to access substance use treatment, that they are also dealing.
Ko ta hai ne le ma ho inga ta. Mo na pito me agonu ko mai afa te ta afa palu. O fe ma ke fe na pasi ai traditional culture ke fe na pas ma traditional cultural practices, Ko le agoni ko ai tangata uri ko ni ne tau tok fanongo ki ai ko Prance E. Courtney, ko Executive Director ya HIV Education and Prevention Project of Alameda County. O talanoa o toi maari e ange whaunga ia ai kautama koe ni. Koe uhi, he oku nau tokanga ki nau tolu ia ki he wā koe o toko taha koe o ne mau tāmakia e whaito o kona tapu, mo e whaito o kona tapu. He o nau ngāwe ki nau tolu ki he wā whengawe aki koe o toko taha koe o mau mo tāmakia e whaito o kona tapu, mo e whaito o kona tapu. Pea mahari au pite ne tala noa koe uhi he nau whaka eke ki nau tolu ia ai kakai koe mo tāmakia e whaito kona tapu o whewheho o mau e whaito kona tapu. Oku ko ha o ngai mea o whai. Ko ha ngai mea o whai ke a. E nau wheinga koe ke nau sio koe ha ho na wā. Pea tok whai lewa i ngā wea o whakatatau ki he wā koe o e drug user pea mo e drug. Ai hange koe ni, ka pau o kou no whai apini o kia hau ki tāhine o whaito o kune mo tāmakia e whaito o kona tapu. Pego hak whanau o mo tāmakia e whaito o kona tapu. Ko e o tau sio maupe ki tau toluia ke taofi. You better stop it. Tuku a ife a isi. Tuku a ife marijuana. Tuku e ha. Kau teka ke tau eke e tau tolu ki ai. How you doing with drugs? Yeah? How are you doing with it? How many times you take it? Osko ya pa tok e ke rewa ka nau tol, ko ha ho palani. Oku ke whakakau nai ke ta ofi a ho ngawe a ke whaito o kona tapu. Pea ka pau lewa aku iyo, ko ha ho tau mua. Ko ha ho ngawe o ke pehe, o toton ke whai, ke tu usi ai ho wā pea mo e whaito o kona tapu. Pea ka paulewa tene hanga toki outline atu iyo o whe o koufu whaka amua wia ke oa te uto iwhi whaitoko na tapu ke uto e ngawe ake whaitoko na tapu. Pea ko wha amau ke motu au pito homa wā. Pea te nau toki ngā ue lewa ki nau tolu ki he whaunga koe ke tu usi ake ai hono wā mo whaitoko na tapu. O nau mau inga ianga ki nau tolu he wā koe o to taha drug use pea mo drugs. Pea whaia e nau ngāwe. O kune pehe, ko ka pau te tawo ki he kaisa, ko tawa ki he kaisa, they provide a medical resources. Ko nau tolu, te nau lawa nau tolu providing resources ke heke. Peke nau access a toko tawhai toko na tapu, ke ngai mea ke he peu sai iai. Pe tok whaire vai e nau ngahi ngāwe. Aia ko tahaya e mea maho inga au pito ho ek mo ka inga e tau wakai ki ngai whaunga ko ia o ku tau i aki e he kakai ko e ni mo ngai pot ngawe ko e ni ai whaito o kona tapu. O ke kai ko e whaunga ia, ta koe ko e whaunga ko e ni ko e tau hanga o stigmatize pea mo luma e kakai ko e whaito o kona tapu, mo whaka ehi me iai, mo tā tapu ne ngai matapāpea me iai, mo tau hanga tu usia me ho tau whamiri, o ke kai ki ngā ue ia. It will make things worse. For tau ke ngai taranoa koe no tau whanongo ki ai. Koe whaunga koe o nau whai e nau tolu, o whia mao ke nau toe wā ofi ange mo kakai koe ni, koe unga ke mahino ai tūkunga whakakaukau o nau iai, pea tipeni me iai a hono outline ai palani ki hono whaito o tō taha koe ni. Na e taranoa koe ni ai whewhine India kula ane nai, pe koe Native American ane nai, ke he mahu inga ke kau Native American a e nau ulunganga whawhonua. Ai a ka pau o tau pehe koe taha o ngahi polokalama na e whakahua tu ke ngawe ake koe Native American ko ki nau tau toko lahi taha kakai o nau mate, pe me ova tau se whai toko na tapu, whakawhenaki ke ngahi matakari ke he. They are the highest rate i he mate ko ia. Pea ko ki nau tolu pe, ai first victim ko ia i he war drugs koe nungo tonga hoko ko ia i mamani he taimini, i Amerikani he taimini. Na e behe fine ko ni en emphasize ko ia ai mahu inga ahona ulunganga whafonua. Because traditional. O mai e kakaia ko ni ki hona o siakare, ki hona reservation. O mai na o toluia o na ngawe whakatahai. Pea ko ene lawe ko ia ki he kata whamuimon. Oku tau te whoki ke tō taha koe ni ai whae ai whiwhine koe ni Native American. O glaupe o mai e nau tolu ai ka kai koe o mo tāmakia e whai tō kona tāpu. O nau whe mau ke nau toe wāo whiange mo nau tō. Pea koe polo kalama koe ni koe wellness journey. O pe o mai lewa ka pau koe wellness journey o mai pea me he outside world o koe nau polo kalama. O mai nau hanga e nau tolo dismantle pe nau vete ki e polo kalama ko whi polo kalama ngā ue ko ia. Ko e uhi pa nau to kanga lewa tau o wha upe e whi polo kalama ko e wellness journey for their own, with their own culture. Aki pe e nau ngahi tō onga mo nau ngahi ulunganga ko e aho nau kakai. Aia ko uhinga ia ko e ne pehe o ku decolonize ai ngai service ko whakahuma ke reservation ko uhinga he o mai ko ngai service ko ia pe au nau hanga e nau tolia o vete ki ia pe a wha ulewa me ia e fo i polo kalama o whe unga mo tāu pe a muha nau ulunganga whakafonua. Whakahuai e nau ngahi healing process, traditional healing process ia a nau tolu. Whakahuai e nau ngahi whangaki i lau mahalo me whangaki i mea ko ia. Koe ha e nau traditional medicine. Pe au oanga pe choice ia ki he toko taha ko ia o mo tāmaki ia. Pe e fie alu ki he pe o ku fie alu ki he rehab pe i kai. Ka oku nau whe ngawe aki e nau traditional process pe a nau tolu. O gai me nau healing ceremony pe koe ngahi o wau ko ia o e healing o nau whakahoko pe nau tolu, ihe e nau whaunga pe nau tolu. O nau pēwhoki o nau mahu inga ia au pito, ko e process ko toa pe o ku whakahoko ihe reservation pe ki ho nau kakai, ke connect e ofi au pito ia pe mo nau ulunganga whawhonua. O nau tui, ko e kakai ko ia mo tāmaki ai whai tō kona tapu, o whie mau ia to keep them closer to them, ka oua e tautea i ki nau tolu he taim kotoa. Hage koe mea koe au hoko koe ngai aho ni, lahe o pito aho no, toko lahi taha kau ngai pōpula i loto, i ngai a pōpula koe whai tō kona tapu. Pe he Native Americans ia, o nau tui ki nau tolu ia, koe ka kai koe au mo tāmaki a, they need to be closer to them, pe i he taim ta tau pe, pe au kai ke nau tui o te tonu ke tautea i ki nau tolu, i he taim kotoa pe, kai whakahoko ha ngahi healing process pe koe ngahi whaito. Kia ki nau tolu, pe au kai ko whaito o pe ko healing process ko ia oku no, ka oku loloa pe ko pau ke up and down and up and down. E tai me sai, e tai me ko. He mei whafuafua ia pe sete fitu noa e ka kai o awe ki rehab, pe ko te lahiange ai, o nau te whoki pe o whae mea tatau. Ko ta haia ai porokarama o ku maho inga au pito e kumai ka inga ke tau wakai ki ai. Na ako e tau approach. Max ai ko tonga e ta ia ke whole drugs. Ko moni e. Ko tonga ia o ku tuki ia pe ave ia tuku he loto wao. Ai tō taha koe whai tō kona tapu kai tō ngofua ke tuku tau api. Ko e whaunga ia. O tau tui kai ai ka kai toko lahi. Ka koe approach koe ni koe o ku whai e he lea koe ni. O ku kai ke ngata pe o ku kia te au ia o ko o ia. Ko ngā lahi ai o ko o ia. pea o ko maria ia, pea hange ke tau o ko tui au ki he whaunga koe ni. Pea koe ke o hinga ia ke o mai nau tolo whakapere pere o mai nau tolo whakapere pere. Ka koe tau whaiha whahinga ngā ue, ke o ngoi e tō taha koe ia, ne ongo e ne whaito o kona tapu, ka o tau kei ofa pe ai. Hange koe lea koe ne whiwhine Native American, koe generosity, koe taha e na urunganga whawhanua. Pea ko nā wā o ko nau ki community, ko nau tolu reservation o nau iai, ko nā wā o nau tolu ki he toko walu noa, ko nau hawhaki. Mena tui ko mau tāmakia pe, koe step hoko pe me mau tāmakia whaitoko na tapu, koe overdose i he whaitoko na tapu. Na o save nau toi ngai mo uia walu noa, walu ngofu tupu. I he ngai whounga koe ni na nau whai. Pe au nau tui ki nau tolu, o ku ngā ue angeia. Ko tau tolu i tonga, ka pate tau sio ke whounga koe e tau approach i hono tila koe mo e tau kau whaitoko na tapu. Hange koe mea koe ulawe kia e tangata koe ni a Max. Koe tai, pia koe tai pe ke hola whaitoko na tapu me ai pa tau tui o saia na ia. Koe molu ia koe nā ko saia. E kai ten toi whai ea mea koe ia. Hange koe e te tai a kita koe mone lea koe ta Afrika a Siri. Ai o mau inga ke tau toi si ofi pe tau whonga koe tau i ake whaitoko na tapu. O nau pefo ki tōlai taka kai o kui piri sone koe koe kau whaitoko na tapu. Koe punishment koe o ave i he taimi ko toa pe alupe ke toi lahiange ai mamafa o tau tea koe a kakai o mau me whaitoko na tapu. Whakalolo maangia tōngai. He kui kai ke ai ha toi whounga pehenia ko tui pegu e Salvation Army ka ko pau ke ulaki ngai popula he ka toko mai ke Salvation Army. Ko tau tolu, lahi au pito ngai whounga pe ko tau tolu ko i murini, lahi au pito ai ngai service e lava ke tau access ki ai. Hage ko mea koe au nau whakamama whai mai, ho ek moi ka inga ko Amerika eni, o ku lahi ai ngai service e lava ke tau o ave ki ai, ha tau whamiri, pe ka pau o ku te ongo i pe ki tau te hange ko te mei mihi IC, pe te alu ki ai he te nau lava toko ni i ki tau tolu, ke toi wā mama oangi ho tō wā mo i whaitoko na tapu. He koe wā awhiang ho tō wā mo i whaitoko na tapu, koe awhiang e ia a ho tō hala ko ia ke overdose pe me i whaitoko na tapu. Ai mea koe au whai kia e tō kanga, Amerikani he taimini, he alu ke toi toko lahiange. Ango lawe koe ni ai presteni koe ni pia mei he Sierra Health Foundation, tau eni hongo fule na whai whatongia. O osa ka papau ia, me ngai tau ko mari watu, koe paanga e ono ngea no ua miliona ko osi wahe i ke kau taha koe ni. Koe ngā ke nau hanga wahe atu ke ngai non-profit organization, ke nau whai e ngā aue koe ni e whaitoko na tapu. Ka koe tau e hongo fulu koe ni nau ngā aue, nau pehe, o kui kai holo e whikaia. O alu pehe ke toi lahiange, pe toi toko lahiange ai kakai, o nau mate pe me whaitoko na tapu, pe koe overdose me whaitoko na tapu. Pe ko wheliuri wake e nau whonga, o a o mai ke whonga koe ni o ku tau taranoa ki ai i he houani, o a mua e luma i ki nau tolu, kai toi whakawhiwa whi mai ki nau tolu, koe uhi ke nau a o ngoi o ku te whengawe aki mo ia, ke toko ni i ahono wā pia moe drugs, koe ngā ke toi ki i wā mama oange. Kupule tau taimi, ka kuia e whamalo heni ki Ethnic Media Services, ka e mai senta ko ia ki Sierra Foundation, mo Sierra Health Foundation, ko ngā koe na whahoko, ai whataha anga koe ni, ke lava ke tau whiinas aki ai, i he houani, whatawange pēna e ongolele i ato e polokalama koe ni, ka koe Fighting Substance Abuse, Breakthroughs in Preventions and Recovery, aia o ku whapanga ia e he Ethnic Media Services. Ka tau hokatu mua poe tau ngahi polokalama. I lava pe tau ki whahiwa koe ni.
Non-profit and public health agencies.
O tu hakela Sama Kotoma Iho.